Hi, good morning. My name is Brianna. I'm one of the public health nurses at the HKPR District Health Unit, and I am here to show you what a day in our COVID-19 immunization clinic might look like. So to start off, when our clients arrive, they are greeted by one of our volunteers. They are screened for any COVID symptoms, their hands are sanitized, and then they are directed to walk through to the check-in process. So as you can see, they just follow the lines here. There's stickers on the floor to ensure a 6-foot distance is maintained. So we're just walking through the check-in process here. Once they arrive at this particular station, they're greeted by a volunteer who has a clipboard that has the list of all the appointments for the day, and that is where the person is checked in. So they're checked in to ensure that they do have an appointment, that they meet vaccine eligibility criteria laid out by the province for that current time, checked that date of birth and health card number match to make sure that they can come in to receive their immunization. So as you can see, for this particular immunization clinic, we do currently have 4 columns set up for immunization purposes. So a volunteer will direct the client to a particular aisle to receive their immunization. Once a client is directed that it's their turn for immunization, they follow down the aisle. And as you can see, all of our immunization stations are set up with color-coded cards indicating various things for immunization. So the process that we're currently using is a pod model. So when a client comes for their immunization, they are seated in the chair here. They are checked into COVAX by one of our administrative professionals. They are asked a series of safety questions to ensure that they are able to receive the COVID-19 immunization safely by the health professional who will be immunizing them. Once they sit down, they do not leave this chair for the entire duration of their immunization process. Once their immunization is completed, a volunteer does remain with each client for that full 15 minutes to make sure that they are feeling well and to be available to flag a healthcare professional if intervention or consult is required after the immunization. And when they leave their appointment, they are directed down the arrowed aisle to the checkout station. As we do make our way to checkout, I will just point out the waiting area that we do have available. So there are several chairs available here for potentially caregivers who come with maybe a parent or somebody that they're caring for. If there's not enough room in the aisle, they can be seated here. You will also notice in the back here, we do have our medical recovery station. So we have 2 stretchers in here. It contains our anaphylaxis kit, any first aid materials that we do need. At all of our immunization clinics, there is a physician on site for the entire duration of the immunization clinic to tend to any medical needs that do arise. As our clients move to the end of the process, they move to the checkout process. So this is where the clients will be checked out at the end of their immunization. They're checked out by some of our wonderful volunteers. This is where they also receive receipt of their COVID-19 immunization, and they will also indicate on their receipt the date of their next appointment, which is in 16 weeks. There are so many advantages to this type of clinic setup. It is such a convenient process for all of our clients who are coming. It's a one-stop shop. They sit in one seat and they don't have to leave. They're in the same seat for their check-in process, their immunization process, and their 15-minute monitoring process. Everybody is moving in the same direction from check-in to check-out, so it doesn't get convoluted or congested. It's a very easy process for all of our healthcare professionals as well too, because they don't have to worry about who they have or have not immunized, who has or hasn't been checked in because of those color-coded cards. Everything is very well laid out. Everybody knows where everything is, and everybody works together for a very smooth immunization clinic.